Hey everybody, this is Jeff from TDC bringing you a special summer policy update. I'm a white male with dark graying hair pulled back, I'm wearing a purple t-shirt, and I'm standing in front of a beige wall. In April, the Centers for Medicare and Medicaid Services, or CMS, proposed a new rule that would impact the delivery of home and community-based services. And to be very clear, this is a good rule. Not perfect, but very good. The proposal would increase access to HCBS, strengthen accountability, promote transparency, and improve the quality of HCBS in Tennessee. For example, one of my favorite parts of the proposal is the requirement that TennCare publicly report on the size of their HCBS waitlist, the average time somebody sits on that waitlist, the average amount of time between approval for services and actually getting those services, and the percent of services a person actually receives compared to what's allotted to them in their beneficiary plan. And there are a lot of great parts of this proposed rule that we just can't fit into this short video. The proposed rule is 130 pages of very fine print legal jargon. And so that you don't have to read all that, we've broken down some of the most important stuff into a summary that you can find linked below. But I think the most important thing I can share with you in this video is my sincere request that you take a few minutes and submit a comment on this proposed rule. This is a good rule, and good rules don't come around all that often. We must take this opportunity to ensure that we get the most out of this chance. Every comment that gets submitted to CMS about this rule furthers the likelihood that the good parts remain in the final rule. And hey, it isn't a perfect proposal. Your comments could make this rule even better. CMS is required by law to read, consider, and respond in writing to every comment and suggestion submitted about this proposed rule. Your voice is absolutely vital to getting the best HCBS rule possible across the finish line. You don't have to be a policy expert. You don't have to be an expert in this long technical rule. You just have to be an expert on yourself and your experience with HCBS in Tennessee. And I strongly encourage you to share this expertise with CMS. The deadline for submitting a comment on this proposed rule is July 3rd. You can find our summary of the proposal, which goes into greater detail on the substance of the rule, on our website, as well as links to other resources and the link for submitting a comment. Thank you for watching, and thank you for considering submitting a comment to help make HCBS in Tennessee a lot better. This has been Jeff. Catch you next time.